Hello, my name is Sheila Mattley. This is for my Communication 1321 Business and Professional Speech. This is my persuasive speech. Breastfeeding is the best thing that you can do for your child. Breastfeeding has many health benefits for your baby, and exclusively breastfed babies have fewer infections and fewer hospital admissions. Breastfeeding has been linked to higher IQs, decreased infection, decreased obesity, and increase in mother-infant bonding. There is a decrease in the number of women breastfeeding right now. There's a lot of factors that are involved when it comes to making the decision to breastfeed your child. Some women are not breastfeeding because they think that means that they are the only ones that can feed their child and means that the father or nobody else can help. Another thing is that there's a very negative outlook on it for breastfeeding in public right now. To get around not having family help, you can breast pump and put your breast milk in the bottle, and then the father and the family can also be the ones helping you feed your baby, so that you don't have to have all the responsibility of getting up every 3 hours or every 2 hours to go and breastfeed your child. The father can also do it and also get some time to bond with their baby. If you have to breastfeed in public, they now make little capes that you can wear that covers up the baby, and so that people don't have to see you breastfeeding in public. Infants that are formula fed have an increased risk of infection and more hospital admissions. One big problem, especially for premature infants or low birth weight infants with formula feeding, is necrotizing enterocolitis. Necrotizing enterocolitis is a very serious medical problem for infants. It's when part of their gut, like their intestines, starts dying because it's not able to digest the food and it loses blood flow to that certain area. When this happens, the infants have to be in the hospital for up to it could be up to 6 months, trying to get their gut to relearn to digest their food and get back up to normal function. Sometimes part of their intestines also have to be removed since it died, and that causes long-term effects on the baby. A study by Jordana Mansbacher showed that breastfed children have fewer behavioral problems such as lying, stealing, hostility, and anxiety. These are some very serious issues with children, and it's an easy fix to breastfeed your children. Also, breastfed children have a decreased risk of allergies, asthma, diabetes, and some cancers such as leukemia. A way to fix this problem is that when women come in for their prenatal visits like ultrasounds and checkups, the nurses and doctors need to start telling them about breastfeeding and the benefits of it and the cons of formula feeding. The sooner they get told the information, the more likely they will actually breastfeed their children. There's also benefits for the mother. It can help you lose your baby weight faster. It can also help decrease your risk of some cancers and diabetes. I work in the NICU right now in the neonatal ICU, and we try to encourage our moms from the beginning to breastfeed their babies, and we tell them all the effects that infants have when they're formula fed versus breastfeeding. There's a lot of moms that choose not to just because they can't be with the infant all the time, but it really does help the infant to be breastfed and promotes bonding. So breastfeeding, I strongly believe that breastfeeding is the very best for your child. And I think every mom should breastfeed for at least 4 to 6 months to get all the benefits from breastfeeding for their child. For my presentation, I used WebMD, a breastfeeding overview. I used a quality improvement study to increase breast milk use in very low birth weight infants. I used Breastfeeding Benefits by Jordana Mansbacher and womenshealth.gov. Thank you.